Hey, good morning. I am so glad you joined us today. Thanks for being part of our family of listeners here on the HealthCall Radio Hour. If you are new here, if this is your first time around, you picked a great day to come by. A lot of interesting things to talk about as we start today with a major complaint about one element in our healthcare system, and that is the cost and some lack of transparency about the cost of healthcare services. And we're going to take a look at a new trend called the direct primary care model addresses that. Healthcare is one of those few services in our lives that you pay for, that you buy without really knowing the full cost in advance. So when a doctor recommends a procedure, a treatment, chances are if you ask the question, what's this going to cost, you might not get a clear answer. So we're going to look behind the stethoscope on what may be behind some of that with Dr. Jarrod Wiegman from Indiana Direct Primary Care. He's here in the studio with us this morning. Good morning. Glad you came in.
Good morning. Thanks.
So tell me about that. Why can't a doctor tell me what something might cost? There's no prohibition. There's no rules that says they can't share that information.
Right. So a lot of times doctors don't have a lot of control over what things cost. If they work for an institution, a large entity, the entity sets the prices for those. So from a cash price basis, there's no way to memorize every price that is set not by you, number one. And two, people that do have insurance, there's no way to understand exactly what their deductible is, their copay, if they've met those, how much out of pocket they have to spend. So every individual person, there's no way to sit down and say, this is what you'll have to pay for this.
Yeah, well, that makes sense. I guess the docs, I want them focused on how they're going to help me get better and not all the BS, frankly, that goes on with when you're dealing with insurance. That complexity when it comes to hospitalization, though, grows exponentially. There is a big variety of costs, hospital to hospital. There was a study out just this week that said Indiana ranks fourth best in the nation for transparency of hospital costs, of procedure costs in a hospital. Part of that is because the state of Indiana, went beyond a federal law and required some additional transparency. And there's now a website that's published where you can go and take a look at and shop between hospitals. And Doc, I was really surprised at some of the cost differences. A non-trauma total knee replacement at a Fort Wayne hospital, the cost was listed at $71,000, but the same procedure at a different hospital over in Western Indiana was $43,000. So that's a big difference. The average treatment cost for a stroke with a clot in Indiana, the average statewide, is $35,000. But at a Terre Haute Regional Hospital, they are listing the price there at $62,000. So huge variances in cost. It pays if I'm the consumer to go and shop that around. But my question to you is, am I going to get a lower quality of care if I'm paying the lower price, or a better quality of care if I'm paying the higher price?
No, you shouldn't. The standards are the same regardless of what hospital you go to. The difference in those prices can be put to a number of different things. Hospitals can set their own prices for anything, and so there's a different margin that each hospital uses. But in addition to that, every hospital has different sets of resources, and the more resources you have, the higher the cost may be, but also the more volume they may do, or the more complex cases they may do. So when you look at a larger city, for instance, they may do more complex cases for certain things, in which case the cost is just naturally going to be a little bit higher for that.
Got it. So one of the things that drew you into this new model of care is it's a lot simpler. You don't have to deal with all that complexity. So your practice is direct primary care. And unlike a traditional doctor where I'm paying for an office visit and paying for a procedure, in your model, I pay one price per month, and that covers anything you can do for me in the office, correct?
Correct. Yep. We try to simplify everything, and we're able to do that because we cut a lot of the overhead out. We cut a lot of the billing, the insurance, the administrative side of medicine out, which is a big expense these days.
Yeah, well, with all the complexity we just discussed, everything you've got to deal with, I get that. So let's talk some examples here. If I go to have, say, a mole removed in a traditional doctor's office, the prices I'm seeing are anywhere between $150 and $300. Does that sound about right?
Yeah, I mean, that's correct. And again, it depends on the area that you get it from. You get it from a primary care doctor's office, it might be a little bit more on the $150 side. A dermatology office is a little bit more specialized. They deal with more complex cases. You're going to see that more on the $300 side of that.
And in your office?
It's a free procedure, essentially. We do the procedure for free. There is a secondary lab to that. So oftentimes when you have a skin lesion removed, it needs to go to pathology to be looked at. You're getting it removed for some reason. So when you have that, there's a cost that I can't control, but we do have the ability to work deals with some of the labs in town, so we can minimize that cost. So for average pathology specimen, it's about $60.
Now, what would it be in a traditional environment? Do you know?
Again, it depends on insurance, but if you're looking at cash prices, that can be it's well over $100, but it could be $200 to $300 depending on, they have to do special stains, different things to it.
Wow. What about other things like a joint injection? If you were going to do some steroid for pain relief, is that something you can do?
Absolutely. So we do different joint injections for people that they often don't realize that primary care doctors can do. We're trained to do those things, and oftentimes patients are sent off to other places like the orthopedic office. And no, we definitely can do those. Again, a free procedure in our office. We charge for the medication used for the procedure, which is the steroid. Costs about $15.
$15. What am I going to pay in a traditional office?
So traditional office, depending on where you go, again, primary care office versus somewhere else, you're going to look at about $100 to $200.
Wow, that's shocking. Are your patients surprised when you say, well, yeah, this is $15?
Yeah, absolutely. They're not only are they surprised at that, but most of them are surprised that we could even do it in the office. Most of them, come in and they're like, I need a referral to the orthopedist so I can get my injection. And I sit down and tell them, well, we could do that here, and they're really surprised at that.
So why are those referrals happening? Why are so many patients accustomed to being referred out to a specialist?
I think a lot of it is time in the office. It does take a little bit longer time to do procedures. So oftentimes when you come in the office, you have about 10 or 15 minutes to be with a doc. And, it takes 10 or 15 minutes to, do a procedure. So that's all you're going to get done. Not to mention if it's not something that you're booked for. If you're talking about something else, then you got to prepare for it. There's, medicines you have to draw up, other things you have to do. You have to get consent from patients. So all that takes time, and it becomes more difficult. And there are some doctors' offices that are encouraged to send them to other people to do these procedures.
So tell me more about that. They are encouraged to send them elsewhere. What does that mean?
So I recently had a meeting with a gentleman who works for a larger entity around town who was told basically by the corporate entity that he works for that he is no longer do those procedures in the office, because if they send him to a specialist office, they can actually charge more for the same procedure.
Oh, wow. Okay. So a business decision, not a medical decision.
Correct.
So I guess the downside of all of that, though, is if I have to pay more for that care, I'm not going to see the doctor as often. I'm not going to go and address an issue, huh?
Right. And I tell people this all the time. It's the same thing for follow-up. So if you come in for high blood pressure, diabetes, and we make some adjustments, and oftentimes we want you to follow up in a couple of weeks to see how you're doing. And oftentimes people don't want to come back because it's another copay, another full office visit if they haven't met their deductible. So they try to stretch those visits out, meaning they're not getting the follow-up really that they need to get to where, they would be their healthiest.
Oh, I get it. So is that what pushed you toward this direct primary care model, was just the simplicity and the chance to, what was that driver?
A lot of the drive was just being able to spend time with patients again. It was knowing that I could follow up with patients and not have to worry about them having an increased cost associated with it. And a lot of it was just from my own experience. When I go to the doctor, I've had insurance throughout the years, and even as a physician, I don't necessarily completely understand my insurance plan. Mm-hmm. So when I look at what the cost is for certain things, and I go to the doctor and I'm paying out of pocket so much, and I realize I've got, high deductible of $3,000, and, fortunately as a physician, that salary can sustain that sort of cost, but the average person can't afford $3,000 out of pocket every year before they get things paid for. So from a direct primary care standpoint, you know what those costs are up front. 90+% of what you need during that year can be done in that office. And it's, for about $1,200, you're good to go.
Yeah, $99 a month is your membership fee, and that covers anything that can be done in your office. And then we're going to talk in a moment about some medications that you have available. And if you'd like to put a question to Dr. Wiegman, he is here in studio with me. You can ring in at 447-1190, 800-333-1190, or you can shoot us a text at 46862, where you put the phone number, just put 46862, and that will come to us here. And I'll put that question in front of Dr. Jarrod Wiegman from Indiana Direct Primary Care as we continue on the Health Call Radio Hour. And back to our conversation with Dr. Jarrod Wiegman from Indiana Direct Primary Care. Direct primary care is kind of a new model. Well, I guess a growing trend. It's not new anymore, but a growing trend around the country. 35% increase year over year in doctors who are stepping away from traditional fee-for-service, where they charge you for a procedure or an office visit, and moving to this sort of membership-based, pay one price, and I have access to my physician. And we were talking during the break there about it's not primary care alone. There are now some specialists who are moving into this direct care model.
Yeah, everybody is really seeing that this is taking off, and I think from a provider standpoint, it makes a lot of sense, and it's much simpler, and it allows you the time to practice the medicine that you train for. So that doesn't just exist in primary care, that exists across the board in all the specialties.
One of the specialties that people get referred out to a lot for is endocrinology for hormone management. Some primary care docs just don't take that on. How come is that, and how do you handle it?
I think one of the things about it is it takes a little bit more time. There are definitely some things with hormone replacement therapy as far as education that needs to happen. There are some follow-up that needs to happen with that. And it's one of those subjects where it's really not a longevity thing necessarily. It's more of a lifestyle and having a good quality of life thing. And so I think a lot of what patient or doctors can focus on in the office in a short period of time, they're looking at the longevity, the high blood pressure, the diabetes, and they just don't get to some of those quality of life things. One of the things that I do in my practice is I really try to balance that quality as well as quantity of life. It's great to have as much quantity as you can get, but if you don't have it with quality, I'm not sure how great that is.
Yeah, I agree with that.